Hi there. Hopefully, you're having a wonderful Wednesday. We meet every week about this time. Real talk for real people looking for real solutions. I'm Tanya Rivens, and this is Canceling COVID. Thank you so much for joining us as we work together to build stronger families. And of course, we're working for our communities in the middle of a global pandemic. We've been doing this now since January, and it's just an honor that you continue to show up and support the conversation and be a part of the solution. Now, today we're starting with a story that's still been blowing up online and it's upsetting a whole lot of people. National headlines, of course, are Walgreens in Monroe. They admit to accidentally giving some patients saline instead of the COVID-19 vaccine. And the store contacted everyone impacted to give them the correct shot. But an investigation is still ongoing. So let's talk about the question of the day. In our question of the day, we want to know how upset would you be if you happen to be one of those people or someone you loved that received that shot? So, what would you say if the Walgreens vaccine mix up happened to you or a loved one? I'd love for you to weigh in on that. And, obviously, things happen, things are going to occur. This is a major undertaking, and this is a task that is really new to everyone as we feel our way through it. But the fact that the vaccine mix up happened, what if it was you or your loved one? How would you react or how would you handle that? So, another big story today, of course, for the first time, we're getting real proof on just how bad pandemic fatigue really is. The number of people social distancing or self quarantining is at the lowest level since last July. So that means you guys are fed up. I'm out of here. I can't take it anymore. But we got to pause for a minute. We can't really see it that way. A new poll has found that 13% of Americans never wear or occasionally wear their mask. That's a new survey high. Come on, guys. I thought we had worked this out with the masks for sure and made them a part of our wardrobe. I mean, I think they're actually kind of cool, especially reading all the different phrases and sayings and then the designs. We can definitely deal with that for a little while because I found it very interesting. Even when you're in some areas that you're not quite comfortable being, if you've got your nose and face covered, and especially during this allergy season, that can only work to your benefit. So let's kind of rethink that. That survey is pretty startling. I get it, the fatigue part, everyone's got cabin fever and it's nice outside, but try and just restrain yourself just a little while longer as we work through this. And as I say that, I see you guys hopping on. Please weigh in on the question of the day. The interactive conversation is what I look forward to the most, and I really appreciate it. So hopefully you'll weigh in on the chat as we start with our first guest. The warnings to remain cautious are loud and clear, especially within the minority communities. Overwhelmingly, we have been impacted by COVID, as you know. And I want to bring in our first guest to kind of talk about what's happening in our community. I'm talking about Reverend Corrine Mack. She's the president of the Charlotte Mecklenburg chapter of the NAACP, a true soldier out there fighting for the community, a lover of our people, and just always on task. I saw you earlier this morning, didn't get a chance to speak with you, but saw you at the meeting and you said it, you put it out there, and you're like, I said what I said, and you guys deal with it. And that's what I appreciate about you. You're unapologetic, always out there fighting for our community. So good afternoon, and thank you for hopping on with us.
Good afternoon. Thank you for having me.
Absolutely. And I appreciate you always being there for me as well when I need you. So, the NAACP, obviously a pillar in our community, fighting for our health and well being always. What comes to mind when you hear how so many people are taking this virus now less seriously? I mean, the survey, we're at an all time low as far as people now getting out, not trying to social distance and not wanting to wear their mask. What do you think when I share that information?
I mean, it gives me some concern. It gives me pause. Simply because we know that in the Black and Brown community specifically, we are more likely to have the worst harms if we get COVID-19. And so I think that we have to be so careful and so cautious. But I do understand human frailty. And I realize that the last year has been difficult on everyone, especially those who've lost loved ones to COVID-19. That they simply want to get back to their lives in some level of um, normalcy. but we will never get back to normalcy.
No, it's going to be a new norm for sure.
Absolutely. And, I just caution everyone to remember that over 500,000 people lost their lives to COVID-19. I personally lost 40 people in my personal life, in
Did you
my
say,
family.
wait a minute, you
In
said 40?
40
Oh,
people.
wow. I'm so sorry to hear
I am
that.
a retired union vice president for transit workers. We lost 120 train operators and conductors, and I represented train operators and conductors, and they felt like an for me, it's personal. For me, it's real. And I can't tell you the level of trauma that I had to deal with and shoulder for everybody
Yeah.
when we someone. It seemed like every week there was one or two people sick, and every week there was
Mhm.
someone transitioning. So please be mindful that our lives are not promised to us, and at any given time, it could be you or someone you love dearly. It doesn't take much for us to practice social distancing, wearing a mask, and really take seriously the idea or the notion of taking vaccines. For those folks who've been raised in the 50s and 60s, we know we took vaccines that actually hurt. I still have that scrape mark on my arm from a vaccine.
Yeah.
And we took booster shots. We did all
Right.
that because it's not
Yeah.
new. Vaccines are not new. I want you to think that if you're young and don't realize that this is something we've been going through for decades. It's part of life. When a new strain comes into society, we want to protect the society. And that's my goal. And prayerfully, that's your goal. And I'm sure that it is that we'll not only protect ourselves, but our loved ones and our communities.
Yeah, I appreciate that. And so sorry. 40 is such a large number. And I know you have an extended family, so certainly condolences. And that does make it really, really personal. You're out working in the community on behalf of so many. And oftentimes people don't stop and think of what you're dealing with. You've got a life outside of, and that's what one of the things that's tough for public servants. And as a public servant, the NAACP has been working really hard to spread awareness about
Mhm.
this disease as well, this pandemic. Kind of talk about what you all have been doing locally and nationally. I know I've gotten a lot of literature and information, and there was a national call, I believe, where some real heavy hitters were on the call discussing it as well.
Yes, well, we've been really intentional. I personally, as a leader, I like to lead as from a perspective of example. And so I personally went out and volunteered to help with the COVID vaccines
Mhm.
several times in partnership with Novant, and I plan to continue to do that. Just helping wash down and wipe down the tables and the chairs, make sure that people are safe, giving them water, whatever they ask me to do is what I do. We have to realize that before we can be leaders, we have to be servants. And when God calls us to leadership, we are then servant leaders. And so that's how I move in my life every single day. Our branch and some other organizations that I'm part of are now working with Novant and trying to figure out how we can actually do vaccines in Black and Brown communities directly. And so that's what I'm working on this week, submitting that proposal, because there are at least 14 areas I could think of that could use a pop up location so that folks don't have to travel to get the vaccination, but
Right.
they're within walking distance. So that's what I'm working on.
And you guys have also done a great job of sending information about events that are happening around the community. I've been getting a calendar of what's happening with the county or where to go. I believe there was a select group of workers that were getting vaccinated. So good job on that and communicating that
Yes.
information. So let's talk a little bit, however, about vaccine hesitancy. And, in our community, obviously, this pandemic has put a spotlight on the mistrust of the Black community when it comes to healthcare. And you kind of touched on that a little bit. Just reminding people back in the 60s and 70s, this isn't anything new. We're still here, obviously. So, what type of conversations are you having with people about racial equity when it comes to racial equity in medicine?
Healthcare is, in my mind, a human right. And unfortunately, Black, Brown, and poor people are the ones who are hardest hit when you think about healthcare in every aspect of healthcare. So, of course, the pandemic would be one that would be glaring that there is some disparate treatment and there is some unequitable practices.
Hmm.
And so we've been having these conversations with the medical arena, with the healthcare providers, with the state to find out how we can better serve these communities and how can we be intentional about ensuring that these communities even know that there are different opportunities, right?
Right.
Case in point, we know now it's already been put out in the atmosphere that there has been white vaccine vacations taken where people who are of means would actually travel into another state where vaccinations are being done, and most of the time it's in Black communities, and they're the ones online getting the vaccinations that initially were set aside for people of color.
Right.
We do that. I mean, I'm smiling about it because initially it was like, "Are y'all serious? It's a joke, right?"
Right.
But I realized it wasn't a joke. In the Black community, where I expected to see people of color staying online, there were numbers of white folks, and I asked them, "Well, where are you from?" Being friendly. They're not even from the state of North Carolina.
Wow. Isn't that
That's
something?
scary. You
Yeah.
see that even in this, the disparate treatment is so glaring, and it's intentional.
Mm.
So when people hear me or anyone else in movement building talk about white privilege, that's one of the things we're talking about. That no one would ever think to question a white person standing in the middle of Johnson C. Smith about to go and get a vaccination. Well, do you live in the neighborhood? Nobody asks those questions. Nobody cares
Yeah.
because we want everybody to stay safe. But I promise you, if we, meaning Black folks, went into a predominantly white neighborhood or a prestigious neighborhood to get a vaccination, they would ask us, "Where do you live? Are you from the neighborhood?"
Absolutely. And uh,
And and disparity.
so I appreciate you sharing that. And one good thing, at least now, more conversation, more attention brought to the whole issue of health disparities and what's going on in our community. So I know your time is valuable. Again, I saw you earlier this morning. I want to ask you the question of the day, and I see some people hopping on now. A compliment for you from Travis Rivens. She says, yes, you do work hard for Black and brown people in our community, and thank you for all you do. So people notice and appreciate you, Minister Mack. But the question is, what would you say if the Walgreens vaccine mix up happened to you or a loved one? How would you feel about that?
Well, I know that I would be angry. To be transparent, I know that I would be angry. Um, and it depends on what the mix up was. Now, saline may not be as dangerous, but there's a possibility you could mix up with the wrong medication and kill someone.
Right.
Yes, I would be very angry, and I promise you, I would not be talking because I would be that angry.
Yeah,
But my would be, and I'm not just being real with you. There is no room for this kind of error. There really isn't.
that's true.
There's no room. When we're talking about folks who already have some fear and caution in taking the vaccine anyway because of the long history
Yeah.
of harm that's been done in the Black community, whether you're talking about Tuskegee Institute or any other situation in our history. Black people are very cautious about taking the vaccine anyway. And then we converse and convince folks it's better to take it than not.
Right.
And these kinds of stories. It takes
Yeah.
steps. And so we have no room for error, not that type of error at least.
Yeah, and it was just saline solution alone, which is what had
Mhm.
happened. And they've contacted everyone, but yeah, that could be very costly. And hopefully, we don't have any more of those problems. Of course, if someone would like to join, of course, get their membership with the NAACP first and foremost. For how many times I've had people, and I know you could certainly be a millionaire for every dollar for every person that calls on the NAACP and they call when they're in need, but don't take the time to get membership now because you should always support this organization. NAACP, Charlotte NAACP.com, or they can call 704 372 7193. That's me telling everyone you should get your card, get your membership. My household, we are all members because we should, if nothing else, realize right now with the climate that we're in more than ever, we need to all be supportive of this civil rights organization. So I'll lead that in to wrap things up. If there's something you would like to say in closing, and one of the things I would like for you to just kind of say or touch on, which is totally not COVID related, but the decision that came down on yesterday?
Well, let me start with saying thank you. You are such a blessing. The entire family is a blessing to the NAACP. Thank you for your leadership in the community as well. What I would like to say about yesterday's verdict was, for me, it wasn't a verdict of justice. It was a verdict of accountability, and it took 12 brave human beings who were jurors who deliberated based on facts and not fiction,
Yeah.
based on facts and not their emotions. And because they did that, based on facts and not race, because they did that, we came out with a verdict that people of color in particular, but all people who understand our humanity, were so grateful for. I want to also thank Darnella Frazier, the thin 17-year-old, she's not
Yeah.
18 years old,
Yeah.
Black female who took the responsibility to stop and record the entire murder of George Floyd.
Yes.
But had she not done that, we'd have never known how he was killed by police.
Yeah.
The initial report given by Minnesota police was that he died in the custody of police, not that he died with a knee at the neck and on his back, as he was handcuffed behind his back on the pavement for 9 minutes and 29 seconds. That was not the report, which is why we know now the police cannot police themselves.
Right.
I want to thank every person that stood out there that day, and I'm trying not to cry, who got on the witness stand and saw George Floyd's humanity,
Yeah.
who cried because they could not save him.
Mm-hmm.
But we have yet to hear Derek Chauvin show any level of humanity or remorse.
Amen.
Yet to hear it. I also
Yeah.
want to thank Chief Arredondo, and every police officer who put a crack in that blue wall,
Yes.
got on that witness stand and spoke truth to power, who said that what he did was wrong, who said what he did was murder, who said what he did was in violation of their use of force
Yes.
policies. That doesn't happen in this country, but it happened in this particular trial. And I believe it's an opportunity we may never get again to create real, sustainable, tangible police reform. And that's what I'm going to do. That's what I'm going to continue to work at doing. And I hope that every person within the Charlotte-Mecklenburg area will work with the NAACP to make that happen in CMPD. Because the problem is not just a Minnesota problem, it's a national problem.
Absolutely. And we all feel better knowing that you're out there fighting for us. So thank you so much, my dear sister, Minister Corrine Mack. Thank you
Thank
for
you.
joining me. I appreciate you. You know I do. And thank you for sharing that. I wanted to make sure that you share that with our viewers as well. So thank you again. And I will continue to be in the fight with you, of course.
Thank
Again,
you.
everyone, support the Charlotte Mecklenburg branch of the NAACP. That sister fights really hard. And you saw transparency right there, and she's real. She is real. Reverend Russell, I appreciate you. Anna Louise Pryor Gates, thank you all for hopping on. Answer our question of the day. Reverend Russell says, I appreciate to the Minnesota Police Department who were willing to tell the truth, as Minister Mack said as well. They did speak truth to power. Reverend Russell, we're going to reach out to you, my producer. We want to talk with you, so look for her to send you a message. Thank you. Anna Louise Pryor Gates says to Reverend Mack as well. Guys, hop in and answer the question of the day. I know my producer said that wasn't a part of the script, Tanya, but I really felt that she really needed to weigh in on that, because that's what she does. She's out there fighting, and again, one of the things that she pointed out, even the young lady that filmed the video, I sure hope someone helps that young lady out, because what she did was huge, absolutely huge on what she did. So as we continue, the question of the day, it's right there in front of you. What if it was you or a loved one that got the saline solution as your vaccine at Walgreens? What would you say? How would you feel? I can imagine it wouldn't be a very pleasant thought. But what we're getting ready to do right now is move on to our regular. She is always joining us on Wednesday. She's a sponsor of the show, and we're so grateful. Dr. Tracia Black of Groundwater Solutions. I appreciate her supporting. We could not do this without you, Dr. Black. So thank you so much. And let's start first with the question of the day. I want to hear your thoughts on that, because you're out here also out there grassroots.
Mhm.
working, fighting, another soldier that's working towards educating our people. And you've got to love people and love community to really be committed to that. So this mix up that is at Walgreens, what would you say if it was you or your loved one that received the saline solution and not the actual vaccine?
I just sigh.
Yeah.
I sighed when I read the article and heard the stories on the news.
Yeah.
And I'm in healthcare, and I know that we all strive for perfection,
Hmm.
but perfection is not possible to attain. And I
Right.
hate it that an error is made in something that is so critical. But I'm excited that they acknowledged it. I was talking to another colleague who works in a clinic, and they had an error with 130 vaccines.
Ooh.
And we talked about how to handle that. And for me, I told her, whenever I've messed up or my organization, we tell on ourselves, we acknowledge it, and we fix it. There are lots of healthcare providers who don't do that, and they cover up the mistakes that they make. And so I commend Walgreens for being willing to say we've made an error and not try to brush it under the rug like I've seen some healthcare providers do. So I know they're going to take a hit right now. The person that I was talking to, she finally did call and give some version to the state about what happened with those vaccines. It wasn't, may or may not have been the complete accurate version of what happened, but
Yeah.
she did take some kind of accountability. Um, and the answer from the state was, this is small compared to some of the other errors that
Oh,
we
wow.
found with vaccine administration. So the fact is that I think mistakes are happening. I think hopefully we keep setting new protocols and new standards. I'm sure Walgreens has put in a super tight system now so that nothing like that ever happens again. And I hope everybody who got the saline injection does come back and get the COVID vaccine.
So for someone like me who's non-medical, when it
Hmm.
comes to profession, I guess my guess is they obviously grabbed something that they thought was a
Hmm.
vaccine, put it in the needle, just to find out that it was saline. Hopefully that's how it occurred.
Right.
But
Well,
would
I'll tell
it?
you, the vials look very similar. I mean, it
Okay.
looks just like saline, where you have to look closely and read and make sure you're getting the right one. So some of the protocols, like for my team, at the moment we receive the vaccines, we inspect the vials. We make
Mhm.
sure we mark them. We add the date we got them. There are different things that we do to ensure that we're taking proper care and being good stewards of the vaccines that are allocated for us. Now, I will tell you that has been we've been out there for a while, so we've had to develop processes, and we add new things every week. When something happens, we say, okay, next week we're going to make sure we do it this way. So
Yeah.
I understand how that error could occur. um, Everybody would just have to be super careful. We have to check, and we have to double check and have appropriate protocols so that we keep our community safe.
Well, Anna Louise Pryor Gates says she would have been really upset, and understandably so. And she probably wouldn't go back there because it is really scary for it to happen. But we know we're human and things happen. But, from the line of transparency, do you think people appreciate what you just said? Kudos to Walmart,
Mhm.
Walgreens, that is. I've
Yeah.
totally picked somebody else. Walgreens and Monroe, kudos to them for acknowledging the error, but do you think people appreciate them being transparent?
I don't know. I think there's probably a level of outrage. How could they do this? Especially folks who are not in healthcare, or
Mhm.
even those who are. We can be pretty arrogant and say, "Oh, I'd never make a mistake like that." But
Right.
we are all human, and so I think we have to have a standard of grace and some mercy in there for people who are really trying to do the right thing. And the fact that they acknowledged it, to me, being a healthcare provider, tells me they are trying to do the right thing, even if they take a hit for it, which they probably will.
Well, Reverend
Just
Russell
from
said,
public perception, they're going to take a hit.
you're exactly right. I would just
Mhm.
kind of give them the side eye and ride on past them to the next one. So I
Exactly.
agree. But Reverend Russell makes a good point. How would people even know whether they got the vaccine or the saline solution? If Walgreens didn't speak up, would they even have any idea which one they received?
They would have no idea, in
Yeah.
fact. And I don't know if I mentioned this a few weeks ago on the show, but the vaccine is supposed to produce antibodies. And there
Mhm.
have been some folks who've taken the COVID vaccine and then tested later and there were no antibodies.
Uh-huh.
So, we hope that providers are giving the right medication, the right vaccine. But unless you test later for the
Mhm.
antibodies, you wouldn't necessarily know. And the other thing is, if you've had COVID, you've had antibodies, and we know that there's a large population walking around who had COVID, recovered from it naturally, and never even knew that they had it. So I think we just have to trust the healthcare providers, make sure that we as providers are doing the right thing, that we're keeping a really, really high standard of excellence,
Mhm.
and that we're honest and with our patients about the risk and all of those things. And that's all I can think of.
Well, and I get from your conversation, it's probably happening a lot more than we are even aware of, and that's the
Mm-hmm,
whole point. But
mm-hmm,
I want to talk about the social distancing. I'm not sure if you heard the numbers where
mm-hmm,
people are getting away from social distancing and doing the self quarantines. We're now at the
mm-hmm,
lowest levels ever since last July. 13% of Americans even are never or are just occasionally wearing their mask. How concerned are you, especially with the cases with hospitalizations on the rise nationally?
mm-hmm.
How much does that concern you?
It concerns me greatly. And we notice, we walk into places or we're out and we see folks, and I'm thinking half of the people in here do not have on masks, and it
Mhm.
is alarming because I know that the numbers are going back up. We expect another large spike in various places throughout the country, and the fact that we are perpetuating this environment of unsafety, that means that it's going to be very devastating, the next phase that hits.
And it's very disappointing because nobody wants to go backwards. We've made so much
Mm-hmm,
progress. So the
mm-hmm,
CDC is warning about another big challenge the country is going to face in the
mm-hmm.
next few weeks, which is the vaccine supply will be bigger than the actual demand for vaccines. Your thoughts on this, and what about Groundwater Solutions will do differently to reach more people? Because I saw the clinic at Bojangles Coliseum. They're shutting down. A lot of people now are taking walk-ins.
Mm-hmm.
Um, that's just
Because the
something.
demand is not great. Those who want the vaccine, most have already taken it. And so
Okay.
now it's just the folks that we can urge to consider the vaccines that are coming in. Um, I do believe those numbers. We talked once about whether there was a short supply. And even 2 weeks ago, I saw that the demand was less than the supply. That if you want vaccines now as a provider organization, you can probably get vaccines. Whereas initially they were prioritizing certain organizations to be able to receive allotments. Now they're going out. You can get them if you are able to provide them. And we can't feel we get the vaccines and we never deliver as many as we ordered.
Oh,
So it's a issue for providers. It's an issue for the state and definitely for our community.
well, we're big on testing. You're big on testing, and that
Mm-hmm,
that should never go away. And especially people who are not interested in the vaccine, at least
mm-hmm,
know your status. And you and I have talked about trying to
mm-hmm,
make this a regular part of your regimen. Whether just like you're going to a hair appointment or the barber shop. I need to get
exactly.
my
It's something that
COVID.
we're doing to keep safe. One of
Yeah,
the things that we're doing now, and we started some months back, but focusing on
yeah.
organizations, businesses, schools, daycares, adult facilities, because we know that when people are congregate, we need testing to make sure that everybody is safe. And so we are seeing I guess the need for that, organizations that are agreeing, okay, I'm going to add this as part of my regular business model or organizational model to keep myself safe as well as the folks that I'm responsible for. So we are usually now we're at a business during the day. We have one large business with 130 employees that we're there weekly testing. And so
Mhm.
that's absolutely necessary. That has to be our mindset. That has to be the new normal.
Yeah, and as you were saying that, I was thinking about ministries as they decide to head back inside the
Mm-hmm.
sanctuary. I wish more organizations would do that. Just focus on testing. Dirk Allman hopped on, my good friend. He says howdy. He got his first Pfizer vaccine at Panther Stadium on April 17th. So good for you, Dirk. If you want to weigh in on the question of the day, as I wrap things up with you, Dr. Black, where are you guys testing today? Your free
We,
testing that's available?
Mhm. We are at Master Cuts on Ashley Road, and we are at University Adult Daycare. This evening, we will be at Kittyland Daycare, testing the parents, children, and teachers. Any organization that is interested in serial testing, they can simply give us a call at 704-596-0505, and we will bring the clinic to you.
You can't get any more convenient than that. Also,
Mhm.
groundwater-solutions.org is the website. 704-596-0505. As we wrap things up, Dr. Black, is there anything else you would like to share?
I just want us to be safe. I want us to be smart, and I want us to be safe, and I want us to make it through this pandemic. And I
Well,
hate to hear Minister Corrine Mack and the losses that she has experienced.
oh
She has
God,
personally helped me
yeah.
intervene on my behalf, been an advocate for me. So I so appreciate her and empathize with that pain.
Yeah, she is working real hard, more so than I think people realize. That
Hmm.
sister's always in the fight. And like I said, people are quick to reach out when they need the NAACP, but they
Hmm.
need to go ahead and support the organization. Membership is not that expensive. So thank you for acknowledging that. And guys, I want to thank you, Dr. Black. You enjoy the rest of your day. I appreciate you. I want to talk about one way Mecklenburg County is working to get the vaccine to more people. Anyone who is homebound with a physical or mental disability, they're eligible to get their COVID-19 vaccines brought to them. You just heard Dr. Black. They will bring the clinic to you if you want to set up your church or organization. Now, Meck County, all you have to do is go to mecknc.gov/COVID-19 for more information. Again, mecknc.gov/COVID-19 for more information. Also, the county is using its You Have a Spot, Take the Shot campaign, which is really catchy. Again, You Have a Spot, Take the Shot campaign to spread awareness about the vaccine. To get the vaccine, spread the word to your friends and family, and make sure you practice the 3 W's. And we can't forget that, of course, is wear your mask, wash your hands, the personal hygiene, and make sure you are still doing the social distancing, which is also known as physical distancing of 6 feet. Just because it's warm and you're outside, things still float around. So just take cautions and be careful. Boy, that was a good conversation with some powerful sisters that really should inspire you to continue to stay encouraged and to just support both of them. I appreciate them on all the work that they're doing. Time for me to wrap up. We'll be back here on Friday, and we've got a great conversation on Friday as well as 1 p.m. I appreciate you all hopping on. All of the faithful and loyal, certainly I appreciate you as well. As always, life's challenges make you better, not bitter. I'm Tanya Rivens. Thanks for hopping on to Canceling COVID. We'll see you again on Friday because together we plan to cancel COVID.